Hello, my name is Yara and I'm an intern at Duke Hospital. Today I wanted to talk to you a little bit about IBS or irritable bowel syndrome and hopefully just be able to provide some basic introductory information on what it is, common symptoms, causes, and more. And hopefully this can give you a little bit of an overview and can be a good starting point for you. It's important to mention that this doesn't cover everything with IBS, so it's important to reach out to student health and to schedule an appointment to figure out what your next steps are. And I went ahead and added the number up here just in case you wanted to save that or have that as a guide throughout this presentation. So IBS is a disorder in the GI tract. It more specifically targets the large intestine, and it causes a variety of different abdominal symptoms. So it causes things like gas, bloating, cramping, diarrhea and or constipation, and change in overall bowel habits. And there's three major types. There's IBS diarrhea, IBS constipation, and IBS mixed, which is just a mixed version of diarrhea and constipation. For IBS constipation, food is actually moving too slowly through the bowel, and so that causes it to be a little bit harder to pass. But for IBS diarrhea, food is actually moving a little too quickly, and that's when you see things like watery stool. Fiber is really important to mention in IBS, and there's two major types of fiber. There's soluble fiber and insoluble fiber. Soluble fiber is really helpful with diarrhea because it slows down digestion and takes out that excess fluid. And insoluble fiber, it's really helpful in constipation because it draws water and adds bulk to your stool. One thing that's really important to consider is a soluble fiber supplement, which could be really beneficial for both types of IBS. But before you do purchase one, it's really important to talk to your healthcare provider and see if that's a best fit for you. This slide just includes some food choices for soluble fiber for diarrhea and insoluble fiber for constipation. I also added a link on the bottom just to be able to provide more information on the difference between the two and just more food choices for each. For causes for onset of IBS, there's a lot of different causes that can lead to its onset, and IBS is really unique to each person. Some people might have one cause, some might have more than one, and some might not really have any on this list. It just depends on one person to another. Some of the causes include stress, food sensitivity, irregular muscle contractions. So if the muscle contractions are too strong, that might lead to bloating and diarrhea. If they're too weak, that might lead to constipation. There's abnormalities in the nerves of the GI tract, severe infections, or changes in your gut microbes. There's also foods that might exacerbate symptoms of IBS. I included the top 5 that were seen in a bunch of patients that do have IBS to exacerbate their symptoms, but it really just does depend case to case, and you might see that in your day-to-day diet, there's different foods that exacerbate those symptoms. So it's really important to be able to talk to your dietitian about that and be able to provide that information so they can help you with making the appropriate dietary changes that can help with those symptoms. For treatment for IBS, the biggest thing to consider is lifestyle changes. And what I mean by that is stress management and reduction. And sometimes medication can be helpful depending on if that's the best fit for you. For diet changes, it's really important to have small, frequent meals, chewing food well, and eating slowly just to not get more air in, because swallowing more air can contribute to bloating. You want to be able to eat in a relaxed environment, increase your overall fluid intake, avoid those foods that might irritate your stomach, and just exercise to relieve stress and stimulate GI contractions. This slide just goes over some medications and what they target, but it's really important to talk to your healthcare provider before you start a certain medication, just to make sure that that's the best fit for you and that would be helpful for you to do. For this slide, I really wanted to tie it into the Do Well Holistic Wellness website, which I added the link on the bottom right here. This just kind of goes over the importance of mind-body wellness. And I think in a situation like IBS, it's really important to consider all the factors that are taking place. Sometimes the onset of IBS might be nutrition related, and sometimes it might be stress related or a combination of different factors. So it's so important to consider mind and body wellness and just being able to incorporate that in our everyday life and just making sure that we're kind of taking the right steps and doing what's best for our bodies. So things like adequate sleep and nutrition, taking breaks throughout the day, listening to your body, not being afraid to disconnect. And if life is a little stressful, it's okay to just kind of disconnect and do what's best for you in situations like that. And the last being consuming responsibly. So if you are 21 and older, just being able to consume alcohol responsibly and in moderation is really important for mind-body wellness too. This is just a handout that you can find on the Student Health Wellness website on the Nutrition Services tab. And it just kind of goes over IBS, a lot of the stuff that I did cover in previous slides, but if you think that it would be helpful for you to print that out and maybe highlight things on this handout that are specific to your experience with IBS and being able to communicate that with your healthcare provider or your registered dietitian, just to be able to target things that are affecting you specifically and being able to provide you with the best resources for that. And this is just additional resources that I think might be really helpful. So I included the Student Health website and the Nutrition Services Department and just a link to make an appointment. There's also the number on the beginning of the presentation if you feel more comfortable calling. But I do appreciate you listening to this, and hopefully it was helpful in providing a little bit of guidance on IBS and just providing a little bit of information and a head start on things that you can bring up to your dietitian or healthcare provider. Thank you so much.